ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಓಕೆ. ಕೇಳಿಸ್ತಾ ಇದೆ ಸರ್. ಅದು ವಿಡಿಯೋ ಸಡನ್ ಆಗಿ ಇಟ್ ಗಾಟ್ ಸ್ಟಕ್ ಐ ಥಿಂಕ್.
ಓಕೆ. ಚಾಟ್ಸ್ ಬರುತ್ತಾ ಇಲ್ಲಿ ನನಗೆ? ಡಿಸ್ಪ್ಲೇ ಇದೆಯಾ ನನಗೆ?
ಚಾಟ್ಸ್ ನನಗೆ ಬರುತ್ತೆ ಸರ್. ಐ ವಿಲ್ ಟೇಕ್ ಇಟ್ ಅಪ್ ವಿತ್ ಯು.
ಓಕೆ.
Okay.
So chats are not directly visible to me.
It's visible to me.
Okay.
Sure. I think we are live.
Okay, sir.
Okay. So good evening everyone. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ವೆಲ್ಕಮ್ ಟು ಫೇಸ್ಬುಕ್ ಲೈವ್ ಫ್ರಮ್ ಆಪ್ಟಿಮಾ ಸೂಪರ್ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಇವತ್ತು ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡೋದು ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟಾಪಿಕ್, ಡಯಾಬಿಟೀಸ್ ಬಗ್ಗೆ, ಮಧುಮೇಹದ ಬಗ್ಗೆ, ರಿವರ್ಸಲ್ ಆಫ್ ಡಯಾಬಿಟೀಸ್. ಸೊ ಇವಾಗ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾಲಿ, ಪೇಪರ್ಸಲ್ಲಿ, ಮ್ಯಾಗಝೀನ್ಸಲ್ಲಿ, ಐ ಥಿಂಕ್ ವಾಟ್ಸ್ಆ್ಯಪಲ್ಲಿ ದರ್ ಇಸ್ ಲಾಟ್ ಆಫ್ ಇನ್ಫಾರ್ಮೇಷನ್, ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ಕ್ಲೇಮಿಂಗ್ ಡಯಾಬಿಟೀಸ್ ರಿವರ್ಸಲ್, ಡಯಾಬಿಟೀಸನ್ನೇ ರಿವರ್ಸ್ ಮಾಡಿಬಿಟ್ಟು ಎಲ್ಲ ವಿದೌಟ್ ಮೆಡಿಸಿನ್ಸ್ ದೇ ಆರ್ ಏಬಲ್ ಟು ಲಿವ್ ಅಂತ. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಲೆಟ್ ಅಸ್ ಫೈಂಡ್ ಔಟ್ more about this, whether it's really possible, whether we can reverse diabetes. To discuss this, we have with us renowned physician and diabetologist, Dr. Binduraj sir. Sir, welcome to this Facebook Live today. Sir is going to enlighten us and tell us about this diabetes reversal, which is this, which we're hearing a lot nowadays. But before we start, before we get in munche, let us learn a little bit about diabetes and its impact on our life. Sir, ಮಧುಮೇಹದ ಬಗ್ಗೆ, ಡಯಾಬಿಟೀಸ್ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಹೇಳ್ತೀರಾ? ವಾಟ್ ಇಸ್ ಡಯಾಬಿಟೀಸ್, ಹೌ ಡಸ್ ಇಟ್ ಇಂಪ್ಯಾಕ್ಟ್ ಅವರ್ ಲೈಫ್?
ಡಯಾಬಿಟಿಸ್ ಅಂದ್ರೆ ಮಧುಮೇಹ ಕನ್ನಡದಲ್ಲಿ ಕರೆಯೋದು. ಸೊ ಅದು ಬಹಳ ವರ್ಷದಿಂದ, ಸಾವಿರ ವರ್ಷದಿಂದನೂ ಇದೆ. ಈಗ ಬಿಕಾಸ್ ಆಫ್ ದ ಚೇಂಜಸ್ ಇನ್ ಲೈಫ್ ಸ್ಟೈಲ್, ಸೊ ಹಾಗಾಗಿ ಮಧುಮೇಹ ತುಂಬಾ ಜಾಸ್ತಿ ಕಾಣಿಸ್ತಾ ಇದೆ. ನಾವು ಇತ್ತೀಚೆಗೆ ಚಿಕ್ಕ ಮಕ್ಕಳಲ್ಲೂ ಕಾಣಿಸ್ತಾ ಇದೆ. ಅದು ಚಿಕ್ಕ ಮಕ್ಕಳಲ್ಲಿ 10 ವರ್ಷ 12 ವರ್ಷ, ನಂದು ಒಂದು ಪೇಷಂಟು 4 ವರ್ಷ. ಸೊ ಏನ್ ಜ್ವರ, ಕೆಮ್ಮು, ನೆಗಡಿ ಅಂತ ಬಂದಿದ್ದು ಶುಗರ್ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಸೊ ಹೀಗಾಗಿ ಸೊ ಒಂದು ಮಧುಮೇಹ ಅಂದ್ರೆ ಬರೀ ಶುಗರ್ ಕಾಯಿಲೆ ಒಂದೇ ಅಲ್ಲ, ಅದ್ರ ಜೊತೆಗೆ ಪ್ರೋಟೀನ್ಸ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಲಿಪಿಡ್ಸ್ ಮೆಟಬಾಲಿಸಮ್ ಇಂಪೇರ್ ಆಗುತ್ತೆ. ಎಲ್ಲರೂ ಬರೀ ಶುಗರ್ ಅಂತ ಯೋಚನೆ ಮಾಡ್ತಾರೆ, ಬಟ್ ಆದ್ರೆ ಈ 3 ಕಣಗಳದು ಒಂದೇ ಇರುತ್ತೆ: ಶುಗರ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಲಿಪಿಡ್ಸ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಪ್ರೋಟೀನ್ ಮೆಟಬಾಲಿಸಮ್. ಸೊ ಹಾಗಾಗಿ ನಮಗೆ ಡಯಾಬಿಟಿಸ್ ಅಂತ ನೋಡ್ಕೊಂಡು 3ಕ್ಕೂ ಸಮನಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಸೊ ಇತ್ತೀಚೆಗೆ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಇಶ್ಯೂಸ್, ಎಸ್ಪೆಷಲಿ ಡಿಕ್ರೀಸ್ಡ್ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ, ಸೆಡೆಂಟರಿ ಲೈಫ್ ಸ್ಟೈಲ್ಸ್, ಜಂಕ್ ಫುಡ್ಸ್ ವಿತ್ ಹೈ ಸಾಲ್ಟ್, ಫ್ಯಾಟ್, ಸಿಂಪ್ಲಿಫೈಡ್ ಸಿಂಪಲ್ ಶುಗರ್ಸ್, ಇದೆಲ್ಲ ತಗೊಂಡು ಜಾಸ್ತಿ ಆಗಿರೋದ್ರಿಂದ ಮಧುಮೇಹ ಜಾಸ್ತಿ ಕಾಣಿಸ್ತಾ ಇದೆ. ಹಾಗಾಗಿ ಜನರಲ್ಲಿ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆತಂಕ ಮೂಡಿದೆ, ಏನಿದು ಡಯಾಬಿಟಿಸ್ ಅಂತ. ಸೊ ಹಾಗಾಗಿ ನೀವು ಇದೊಂದು ಸೆಷನ್ ಮಾಡೋದು ಒಳ್ಳೇದು.
ಕರೆಕ್ಟ್ ಹೇಳಿದ್ರಿ ಸರ್. ಎಸ್ ಸರ್. ಸೊ ಡಯಾಬಿಟೀಸ್ ಆರ್ ಮಧುಮೇಹ ಇಸ್ ಸ್ವಲ್ಪ ಕಾಂಪ್ಲಿಕೇಟೆಡ್, ಬರೀ ಶುಗರ್ ಅಷ್ಟೇ ಅಲ್ಲ ಅಂತ ಹೇಳಿದ್ರು ಸರ್. ಅಂಡ್ ಇಟ್ ಅಫೆಕ್ಟ್ಸ್ ಅವರ್ ಲೈಫ್ ಇನ್ ವೇರಿಯಸ್ ವೇಸ್. ಆಬ್ವಿಯಸ್ಲಿ ಲಾಂಗ್ ಟರ್ಮ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್, ಅನ್ಕಂಟ್ರೋಲ್ ಡಯಾಬಿಟೀಸ್ ಕಣ್ಣು ಮೇಲೆ, ಕಿಡ್ನಿ ಮೇಲೆ, ಹಾರ್ಟ್ ಮೇಲೆ, ನರದ ಮೇಲೆ ಎಲ್ಲ ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿದೆ. ಇದೆಲ್ಲ ಎಲ್ಲರಿಗೂ ಸಾಮಾನ್ಯವಾಗಿ ಎವ್ರಿಬಡಿ ನೋಸ್ ಅಬೌಟ್ ಇಟ್. ದಟ್ ಇಸ್ ವೈ ಎವ್ರಿಬಡಿ ಇಸ್ ಅಫ್ರೇಡ್ ಆಫ್ ಡಯಾಬಿಟೀಸ್. ಅಂಡ್ ಬಿಕಾಸ್ ಇಟ್ಸ್ ಇನ್ಕ್ರೀಸಿಂಗ್ ನಾವು, ನೀವು ಹೇಳ್ದಂಗೆ ಲೈಫ್ ಸ್ಟೈಲ್ ಎಲ್ಲ ಚೇಂಜಸ್ ಆಗೋದ್ರಿಂದ ಜಾಸ್ತಿ ಡಯಾಬಿಟೀಸ್ ಬರ್ತಾ ಇದೆ. ಚಿಕ್ಕ ಮಕ್ಕಳಿಗೂ ಬರ್ತಾ ಇದೆ ಡಯಾಬಿಟೀಸ್. ಸೊ ಅದಕ್ಕೆ ಎಲ್ಲರೂ ಎವ್ರಿಬಡಿ ಇಸ್ ಇಂಟ್ರೆಸ್ಟೆಡ್ ದಿಸ್. ಯಾರೋ ಓಕೆ ತೊಂದರೆ ಇದೆ, ಈ ತೊಂದರೆನ ನಾವು ರಿವರ್ಸ್ ಮಾಡಬಹುದು ಅಂತ ಲಾಟ್ ಆಫ್ ಪಬ್ಲಿಸಿಟಿ ಇಸ್ ಹ್ಯಾಪನಿಂಗ್ ನೌ ಡೇಸ್. ವಾಟ್ ಇಸ್ ದಿಸ್ ಡಯಾಬಿಟೀಸ್ ರಿವರ್ಸಲ್? ನಿಜವಾಗ್ಲೂ ಡಯಾಬಿಟೀಸ್ ನ ರಿವರ್ಸ್ ಮಾಡಬಹುದಾ? ಕ್ಯಾನ್ ವಿ ರಿವರ್ಸ್ ಡಯಾಬಿಟೀಸ್?
ಆ ಪಾಯಿಂಟ್ ಹೋಗಕ್ ಮುಂಚೆ 1-2 ಪಾಯಿಂಟ್ ಹೇಳ್ತೀನಿ ನಾನು. ಡಯಾಬಿಟಿಸ್ ಬಂದಿರೋ ಕಾರಣ ಏನು? ನಮ್ದು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್. ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಯಾವ್ದಾದ್ರು ಶುಗರ್ ಬರೋದಿಕ್ಕೆ? ಒಂದು ಅತಿ ತೂಕ, ಇನ್ಕ್ರೀಸ್ ವೇಟ್. ಅದರಲ್ಲೂ ಇನ್ಕ್ರೀಸ್ ಅಬ್ಡಾಮಿನಲ್ ಒಬೆಸಿಟಿ, ಅಂದ್ರೆ ಕೊಬ್ಬಿನಾಂಶ ಹೊಟ್ಟೆ ಭಾಗದಲ್ಲಿ ತುಂಬಿಕೊಳ್ಳೋದು, ಅದರಿಂದ. ಇನ್ನೊಂದು ಡಿಕ್ರೀಸ್ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ, ಆದ್ರೆ ಜಾಸ್ತಿ ಎಕ್ಸಸೈಸ್ ಮಾಡದೇ ಇರೋದು. ಸೊ 2. ಇನ್ನೊಂದು ಆಹಾರ ಪದ್ಧತಿಗಳು, ಡಯಟ್ರಿ ಚೇಂಜಸ್. ನಾವೀಗ ಜಾಸ್ತಿ ಆಹಾರ ಎಲ್ಲಾನು ಸಿಂಪ್ಲಿಫೈಡ್ ಶುಗರ್ಸ್ ಅಲ್ಲಿ, ದಟ್ ಮೀನ್ಸ್ ಪ್ರೊಸೆಸ್ಡ್ ಫುಡ್, ಅಲ್ಟ್ರಾ ಪ್ರೊಸೆಸ್ಡ್ ಫುಡ್, ಪಿಜ್ಜಾ, ಬರ್ಗರ್ಸ್, ಮತ್ತೆ ಡೋನಟ್ಸ್, ಮತ್ತೆ ಸ್ವೀಟ್ಸ್, ಮತ್ತೆ ರೈಸ್, ವಿಚ್ ಇಸ್ ಪಾಲಿಶ್ಡ್ ರೈಸ್, ವೈಟ್ ರೈಸ್. ಇಟ್ ಡಸಂಟ್ ಹ್ಯಾವ್ ಎನಿಥಿಂಗ್ ಎಕ್ಸೆಪ್ಟ್ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್. ಓಕೆ, ದೀಸ್ ಆರ್ ದಿ ಸಮ್ ಥಿಂಗ್ಸ್ ವಿಚ್ ಆರ್ ಚೇಂಜ್ ದ long run, about many years, from 100-200 years, which are contributing to the diabetes. So if you can address these issues and maintain these risk factors under control, definitely the diabetes can be reversed. That means in remission. Until unless you have this risk factors under control, it will be under remission. Once you lose these risk factors, again the diabetes will come back. So this is the most common scenario. Everyone will ask me whether the diabetes will go, whether can you cure diabetes. There is no, as of now, medically in allopathy, there is no cure for diabetes. So only you can modify the risk factors, bring it under control with the help of medicines, exercise, and diet. All three are essential. It is left to the patient and the treating physician which among these three they are going to prioritize. If the priority is only medicines, the exercise and diet take a backseat. As per my opinion is the exercise and diet equally contribute for management of diabetes with the medicines. So the patient has to be counseled by the physician and individually. The treatment for diabetes is always individualized. The one which fits treat for the one patient doesn't fit for another patient. So always don't compare yourself with another patient. That means that patient is being managed only one medicine. I am taking 2, 3 medicines. So your body habits, your lifestyle, your stress levels, how do you manage things are different from the other person. So please don't compare yourself. And diabetes can be under remission provided you modify all the risk factors. These are only 3 risk factors I have told. The other things are like management of stress, day-to-day stress activities. How do you manage? What are your dietary habits apart from taking this refined sugars and all? Like taking time to time food, taking nutritious food, and including the proteins in food, fibers in the food, and the timings of the food intake. I mean, some people take breakfast at 11 o'clock. It's not appropriate. Some people have dinner at 10, 11 in the night. It's not appropriate. So the breakfast timing should be from 8 to 10, dinner before 8, and in between you can have some snacks at 11 o'clock and 12 o'clock, and 1 to 2 you can have lunch, light lunch. The calorie content of each one should gradually reduce from morning to night. Morning you can have a calorie of around 750 kilocalories, the breakfast, and gradually come to 450, then gradually again reduce at the dinner time. Now, what I'm telling is this is for preventing onset of diabetes. Before onset, once your diabetes is already set in, then the diet is individualized again.
Sure, sir. Thank you so much. I think you put out very important points. I think that is three important points. Nange ಇಲ್ಲಿ ಕಾಣಿಸ್ತು. ಒಂದು obviously diabetes. There's a lot of risk factors, lifestyle changes have happened. That's why we are seeing more and more diabetes. And making changes to this lifestyle, na ಅದನ್ನ correct ಮಾಡಿದಲ್ಲಿ we can actually help diabetes. And that is where some people may be able to put their diabetes in remission, right? But what most importantly, you said that we cannot reverse it. We can put it in remission. Provided we take care of these lifestyle factors,
Yes.
right?
The thing is, lifestyle modification should be sustained and long term throughout the lifestyle, throughout the life. So you should adopt such a lifestyle that you can manage it for a long term, not for a period of 1 year, 2 years. Such an intense activity so that you can't continue, and the whole family is put into stress because of their lifestyle changes. Make sure it is a balanced thing so that we can continue for a long term. Definitely,
So
change
what
is
you
important.
Yes, sir. So what you're saying is some people who claim that they have reversed diabetes, that means they have been able to probably modify some risk factors, and probably in that it may have helped. Is that
Yeah,
true, sir?
definitely. Some people have like I have got patients who are telling that my requirement of medicines has come down because of modification of risk factors. Definitely, they have lost weight. That means lost weight in the sense they have lost weight in a healthy way. Losing weight is a one thing. Losing weight in a healthy way is another different important thing. So the loss of weight should be in a healthy way without using any supplements, and per week should be half a kg, not more than that. That's called a healthy weight loss. If you want to lose weight, the loss of weight should be of half kg per week. So down on your sweets, sugars, carbohydrates, but make sure your protein is good. Don't lose muscle mass when you do weight loss. So those type of people have come to me and telling that they have reduced their medications, their requirement of medication has come down, insulin requirement has come down. But Again, after a period of 1 month, 6 months, it has gone up because they have lost the track of the risk factor modification. Again, it happens. We got a lot of patients, and they still have hope that they can do, but they can do it. But that's what I insist. You start a lifestyle which you can sustain for long. So don't make it sure
Perfect.
for the 2 to 3 months of intensive activity, lifestyle management. Then again you give away. Again it comes back. So that shouldn't happen. The intense weight loss and intense this thing have a different effect on the cardiac. So loss of muscle mass, loss of calories suddenly will have adverse impact on the heart. They can have adverse cardiac events. So that's why it's not recommended to lose weight drastically and lose weight in the terms of protein. You should retain the protein mass but lose the fat and carbohydrate part. With the
Sir,
adequate
ಸರ್ ಟು ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ಸ್ ನೀವು ಹೇಳಿದ್ರಿ. ಒಂದು ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಶುಡ್ ಬಿ ಸಸ್ಟೈನಬಲ್ ಅಂಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಶುಡ್ ಬಿ ಅಂಡರ್ ಸೂಪರ್ವಿಷನ್. ಇಟ್ ಕೆನಾಟ್ ಬಿ ವಾಟ್ ಪೀಪಲ್ ಹ್ಯಾವ್ ಜಸ್ಟ್ ಟೋಲ್ಡ್, ಇದು ಮಾಡಿದ್ದೆ ಅದು ಮಾಡಿದ್ದೆ. ಇಟ್ ಮೇ ಬಿ ಹಾರ್ಮ್ಫುಲ್ ಆಲ್ಸೋ. ಕ್ಯಾನ್ ಇಟ್ ಬಿ ಹಾರ್ಮ್ಫುಲ್ ದಿಸ್?
definitely when you do weight loss, for example ಅದೇ ಡಿಸ್ಕಸ್ ಮಾಡ್ತಾ ಇದ್ವಲ್ಲ, so when you do undergo rapid weight loss, there is loss of proteins also, there is loss of electrolytes, loss of water in the body that can put the body under severe stress and they can have adverse cardiac events. Another thing, the immunity goes down. Make sure the immunity goes down. This is most important. The patients who have lost weight drastically and very rapidly, they have come back with having tuberculosis. That's what I've seen. So it's not advisable to lose weight at your age of 60 or 70. Lose weight when you want to prevent diabetes. Not with the onset of diabetes, it should be gradual, slow. Just 5 kgs in a 3 to 6 months, good enough. So because the already immunity is down because of your diabetes, weight loss will further bring down the immunity, and loss of proteins mass in the body also brings down the immunity as well as your. This is the risk factors for cardiac events. So sarcopenia, what we call loss of muscle mass, not good.
ಸೊ ನೀವು ಹೇಳಿದ್ರೆ ಏನು ಸರ್, ಡಯಾಬಿಟೀಸ್ ರಿವರ್ಸಲ್ ಅಟೆಂಪ್ಟ್ ಮಾಡ್ಬೇಕಂದ್ರು ಎಲ್ಲರಿಗೂ ಇಟ್ ಇಸ್ ನಾಟ್ ಅಡ್ವೈಸಬಲ್.
It's not advisable. Not advisable. Don't aim for reversal of diabetes. Aim for remission of diabetes with modification of risk factors. Risk factors ಅಂದ್ರೆ ಇದೆ obesity. You have to target how to manage weight and how to manage the diet in terms of reduced carbohydrates with adequate protein, fat and micronutrients, vitamins, minerals as well as fiber in the diet. Reduction of smoking, alcohol, exercise, what type of exercise, aerobic exercise, anaerobic exercise, and endurance exercises, and physical strengthening exercises, those exercises, as well as adequate relaxation techniques. All these things play a role. Not only one part, only diet managing will reverse diabetes. No. All have their contribution to bringing the diabetes under remission. Definitely.
ಸೊ ಸರ್, ಈ ಡಯಾಬಿಟೀಸ್ ರೆಮಿಷನ್ ಅಥವಾ ರಿವರ್ಸಲ್ಗೆ ವೇಟ್ ಲಾಸ್ ಹೇಳಿದ್ವಿ. ವಿ ಡಿಸ್ಕಸ್ಡ್ ಅಬೌಟ್ ವೇಟ್ ಲಾಸ್. ಇಟ್ ಶುಡ್ ಬಿ ಎ ಹೆಲ್ತಿ ವೇಟ್ ಲಾಸ್. ಇಟ್ ಶುಡ್ ಬಿ ಅಂಡರ್ ಸೂಪರ್ವಿಷನ್. ಎಕ್ಸರ್ಸೈಸ್ ಹೇಳಿದ್ರಿ, ದಟ್ ಆಲ್ಸೋ ಹ್ಯಾಸ್ ಟು ಬಿ ಸೂಪರ್ವೈಸ್ಡ್. ಅಂಡ್ ಡಯಟ್. ಸೊ ಕಮಿಂಗ್ ಟು ಡಯಟ್, ಒನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್ ಬಹಳ ಕೇಳ್ತೀವಿ ಅಬೌಟ್ ದಿಸ್ ಇಂಟರ್ಮಿಟೆಂಟ್ ಫಾಸ್ಟಿಂಗ್. ಸೊ what is this role of intermittent fasting? Does it help? Can it be harmful? Who should try intermittent fasting, and how do we do intermittent fasting if you have to do?
If you are diabetic, don't do fasting. Very simple. No fasting. Because fasting, any stress on the body requires insulin. If you are fasting, again, because your diabetes, because your insulin is unable to perform these activities. So, if you fast in a diabetic state, you will land up with complications. So, don't fast in diabetes. Just reduce the calorie. Okay. So, depending on the person to person, you consult a dietitian or with your consultation with the physician, you can arrange a low calorie diet with adequate nutrition. So low calorie with the adequate nutrition. This is the underlying statement, not just a calorie reducing the calorie. Okay. Then persons who want to prevent or postpone the onset of diabetes because of the risk factors they have, already they are obese, or family history is very strong with the diabetes, both the parents or a lot of siblings have diabetes, then those are the candidates who can do this intermittent fasting. But intermittent fasting should be done under supervision, because again, the underlying statement is proper nutrition. Just fasting doesn't help anything. You have to have adequate proteins, adequate fibers, vitamins, minerals, and water. So this is where they lack. Intermittent fasting definitely helps in losing weight, but what losing weight is what in terms of losing proteins? No, the protein should be preserved. The fat part should be lost. That's why you have to do intermittent fasting in a supervised condition, so you don't go into severe ketosis and all. This is one thing which you have to do, but definitely it helps under supervision.
ಸೊ
Yes,
ಇಂಟರ್ಮಿಟೆಂಟ್ ಫಾಸ್ಟಿಂಗ್ ಕೆಲವರು ಮಾಡ್ಬೋದು, ಪ್ರಾಬ್ಲಿ ಟು ಪ್ರಿವೆಂಟ್ ದಿ ಆನ್ಸೆಟ್ ಆಫ್
yes.
ಡಯಾಬಿಟೀಸ್
Or
ಬರಕ್
postpone
ಮುಂಚೆ.
means risk factors we are already obese.
ಹ್ಮ್ ಹ್ಮ್ ಹ್ಮ್
Obesity ಇದೆ, your
ಹ್ಮ್
physical activity is less, sedentary
ಹ್ಮ್
lifestyle ಜಾಸ್ತಿ ಇದೆ. So that actually what happens is we are consuming more calories than what is needed.
ಹ್ಮ್ ಹ್ಮ್
For example, for you and me, we hardly do any physical activity. We need 1,800 kilocalories per day. Actually, we
ಹ್ಮ್
will be taking more.
ಹ್ಮ್ 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 ಹ್ಮ್
So rather than burning out that extra calories, start
ಹ್ಮ್
taking less. So that itself is enough. That itself will count into like intermittent fasting. You're putting the body under stress so that it burns more fat,
ಹ್ಮ್ ಹ್ಮ್
utilizing the fat as a source of energy.
ಹ್ಮ್
Okay, that's the main concept. That's all.
Sir, I think that is a lesson for all of us. I think the lifestyle changes, the sedentary lifestyle, ತುಂಬಾ ಎಕ್ಸರ್ಸೈಸ್ ಏನು ಮಾಡಲ್ಲ,
Correct,
ಕೂತಿರ್ತೀವಿ,
correct.
ಊಟ ಜಾಸ್ತಿ, freely available, lot of functions and lot of things, and odd timings of eating, and very erratic ತಿನ್ನೋದು, ಸ್ವಲ್ಪ ತುಂಬಾ ಜಾಸ್ತಿ ತಿನ್ನೋದು, ತುಂಬಾ ಲೇಟ್ ಆಗಿ ತಿನ್ನೋದು.
ಹೌದು,
I think we're
ಹೌದು.
all are guilty with that. But
Yes,
yes, big lesson for us that diabetes can be lurking. So we have to make this lifestyle changes, and it's very important to make this lifestyle changes.
yes,
But very important thing you told is that even this intermittent fasting can sometimes it has to be under supervision. It's more a calorie restricted diet which is
yes.
important, and diet should be balanced. ಎಲ್ಲ ಇರಬೇಕು,
Balance, nutrition
ಎಲ್ಲ ತರ
ಇರಲೇಬೇಕು.
ಬೇಕು.
Yes,
ಅದರ್ವೈಸ್ ಪ್ರೋಟೀನ್ ಲಾಸ್ ಆದ್ರೆ ಇನ್ನು ಕಷ್ಟ ಆಗುತ್ತೆ, ವೇಟ್ ಎಲ್ಲ ಲಾಸ್ ಆದ್ರೆ ಇನ್ನು
correct.
ವೇಟ್ ಲಾಸ್, ಪ್ರೋಟೀನ್ ಲಾಸ್ ಬಿ ಮೋರ್ ಹಾರ್ಮ್ಫುಲ್. ಸರ್, ಇದು ಕೆಲವು ಮೆಡಿಸಿನ್ಸ್ ಇಂದಾನು ಡಯಾಬಿಟಿಸ್ ರಿವರ್ಸಲ್ ಅಂತ ಕೇಳ್ತಾ ಬರ್ತೀವಿ, ಕೆಲವು ಪೇಪರ್ ಅಲ್ಲಿ ಅಥವಾ ಆನ್ಲೈನ್ ಎಲ್ಲ ಲಾಟ್
ಹೌದು
ಆಫ್
ಇದೆ.
ಇನ್ಫಾರ್ಮೇಶನ್ ಇದೆ. ಹಾ ಹಾ
Till date, it was the like bariatric surgery, the surgical part, like
ಹ್ಮ್ ಹ್ಮ್ ಹ್ಮ್
morbid obesity was
ಹ್ಮ್ ಹ್ಮ್
like BMI, body mass
ಹ್ಮ್
index more than 35 ಇರ್ತಾರೆ, 40,
ಹ್ಮ್
severely
ಹ್ಮ್
obese. They have
ಹ್ಮ್
complications because of obesity.
ಹ್ಮ್ ಹ್ಮ್ ಹ್ಮ್
ಅವ್ರಿಗೆ ಓಡಾಡಕ್ಕಾಗಲ್ಲ,
ಹ್ಮ್
ಟ್ಯಾಪ್ ಇಸ್ ವೆರಿ ಹೈ ಅಂಡರ್ ನಾಟ್ ಕಂಟ್ರೋಲ್.
ಹ್ಮ್
ಅವ್ರಿಗೆ ಅಬ್ಸ್ಟ್ರಕ್ಟಿವ್ ಸ್ಲೀಪ್ ಅಪ್ನಿಯಾ ಅಂತೀವಿ. ಆ ಥರದವ್ರು
ಹ್ಮ್
ಇದ್ದವ್ರಿಗೆ ವಿ
ಹ್ಮ್
ಸಜೆಸ್ಟ್ ಟು ಅಂಡರ್ಗೋ ಬ್ಯಾರೆಟಿಕ್ ಸರ್ಜರಿ.
ಹ್ಮ್
But again, it's a very risky procedure. It has its own plus and minus. That has to be
ಹ್ಮ್
individualized. Not everyone is a candidate for bariatric surgery.
ಹ್ಮ್
So that because of the changes in the gut, because the surgery, the gut
ಹ್ಮ್
hormones play a role in the
ಹ್ಮ್
management of like controlling the sugars.
ಹ್ಮ್
These people going for remission for diabetes. So where these people like they start having lesser requirement of medicines. The medicines requirement reduces drastically. Or some people are off the medicines.
ಹ್ಮ್ ಹ್ಮ್
But I have come across 2-3 people who had undergone bariatric surgery and they were off the medicines and they were doing fine for 5-6 years. But they started taking alcohol, food without restriction. They came back to having diabetes. So again, not a reversal, it's only a remission until unless you have the risk factors to control. So it's a live example what I've seen.
Yes, true. I also have seen patients who have lost weight for many years. Weight loss ಆಗಿದೆ, ಮತ್ತೆ it starts gaining, and maybe it's only a remission. It's a temporary sort of thing.
Because the modifier risk factor is not a single prong, it's a multi-pronged approach. You might be managing the diet part, you may not be able to manage exercise part, or you might be manage one part, the stress factor you are unable to manage. So there are multiple, and the genetic factor we can't modify that. So these are multiple factors which contribute to diabetes. So which is under your control, please try to manage them. Don't take a lot of stress to control those risk factors which you can't control. At least you try to control your smoking, your alcohol intake, your dietary habits. Make sure you take food before 8 o'clock in the night. Have proper breakfast, proper lunch, have all the nutrition fibers in your diet, which all you can manage. Please manage. Okay. So coming to that medicine, after surgical, now we have got semaglutide, the new molecule which is being like promoted for weight loss, especially once you lose weight. So they claim up to 5 to 6 kgs they can lose a weight. So once you lose weight, definitely your diabetes comes down, sugar levels. So that's the cornerstone. You have to hit it where it hurts. So you have to hit it in the place where you have to lose weight. So you lose weight, your diabetes comes down. So I have seen patients just losing weight and with metformin itself, they have lost weight around 5 kgs and the sugars are drastically under control. So still there are already drugs which are still working in that way. Your metformin is good enough. Metformin at optimal dose, if they can tolerate it, they are going into like remission. Very low dose of metformin. So there are drugs, but drugs are only to an extent. Again, you have to come back to modifying risk factor. So drugs will only modify one risk factor, the weight. Up to an extent. You can't have extreme weight loss with the so if you are morbid obesity, you are under 120 kgs, it will help you in modifying the risk factor of weight. You have to put your effort with the help of the medicines. That's how it is.
So, surgery is one option, especially if morbid obesity, which will help to put the diabetes in remission. Definitely, it helps. That is what sir is telling. On the medicine, there are some newer medicine which can help in weight loss, and in that way, ಸ್ವಲ್ಪ diabetes na control ಮಾಡಕ್ಕೆ help ಮಾಡುತ್ತೆ. Obviously, you have to consult with the
Yes.
physician and diabetologist, and then only proceed with discuss with them about this medicine. Sir, we discussed about weight loss. We discussed about exercise, diet, medication. We saw where this diabetes reversal. Obviously, it's a myth. We can't put it in remission. From that, what we discussed. One question in my mind is, ಕೆಲವರಿಗೆ mild diabetes ಇರುತ್ತೆ. Obviously, risk factors modify ಮಾಡಿದ್ರೆ maybe it may help them to control the disease well. ಕೆಲವರಿಗೆ ತುಂಬಾ ಜಾಸ್ತಿ ಡಯಾಬಿಟಿಸ್ ಇದೆ, ಇನ್ಸುಲಿನ್ ತಗೋತಾರೆ, ಇನ್ಸುಲಿನ್ ತಗೊಂಡ್ರು ಹೈ ಡೋಸ್ ಇನ್ಸುಲಿನ್ ತಗೊಂತಾರೆ, ಅವ್ರಿಗೇನಾದ್ರೂ ನಾವು ಈ ತರ ಅದರ್ ರಿವರ್ಸಲ್ ಮೆಥಡ್ಸ್ ಏನಾದ್ರು ಅವ್ರಿಗೂ ಅಪ್ಲಿಕೇಬಲ್ ಆಗತ್ತಾ, ಅಥವಾ ಬರೀ ಪ್ರೀ ಡಯಾಬಿಟೀಸ್ ಮೈಲ್ಡ್ ಡಯಾಬಿಟೀಸ್ಗೆ ಅಪ್ಲಿಕೇಬಲ್ ಆಗತ್ತಾ?
ಇಲ್ಲ, the thing is modifying risk factors is applicable to across for pre-diabetic or they want to prevent or they are diabetic. So that risk factor modification is what we call it diabetes reversal or diabetes remission, what we labeled as. So risk factor modification is an ongoing process, never stops, and it applicable for everyone. So
at any stage.
So depending, it will be individualized. So if you are a pre-diabetic, you are different process. If you are diabetic, it's a different process. And if you don't have any this thing, just a risk factor without any diabetes, then definitely it's a different process. But definitely it helps. You have to do counseling for each patient regarding modification of risk factor, so that the diabetes under control. At least if you are patients who require high dose insulins, you have to sit with them and take a detailed diet history. That's what lacks. Diet. Everything, everybody tells I don't, ನಾನು ಅಷ್ಟೇನು ತಿನ್ನೋದಿಲ್ಲ, ನಾನು ಕಮ್ಮಿನೇ ತಿನ್ನೋದು, ಅದು ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಇಲ್ಲ ಅಂತ. But the thing is, at what time they are taking, how much they are taking. To take, for example, anybody takes food after 8 or 9 o'clock, is automatically converted into fat. So that's how the body is built. Once the sun sets, the circadian rhythm thinks that body doesn't require any energy after like sunsets and no activity will be done. It will try to conserve the energy. So it will not spend, it will conserve. So its conservingness, you are automatically converted to fat. That's how the body works. To take more calories, it's converted into fat. So once the more fat, you have more insulin resistance. So the amount of fat, we don't analyze the fat in the body of any person. So for example, 1 or 2 grams of fat in the pancreas can cause diabetes. 1 or 2 grams is not the kgs less. 2 grams of fat in the pancreas can cause diabetes. So just imagine how much of fat we carry if you are diabetes in the abdomen. So abdominal obesity, the most thing which we don't analyze and apply any mechanisms to address that issue, abdominal fat.
Sure, sir. Sir, we have a question from the audience. I think Asha has commented that her father is diabetic. Is it genetic? Should she be worried? Should she be worried about it?
Genetic diabetes means usually the onset in the siblings, the next generation will be very earlier. So type 1, what we call diabetes. So only in those conditions we go for genetic testing. And India, because resource restricted country, we don't actually go for genetic testing for diabetes. Only the we assume it's a type 1 diabetes, younger onset. We see for auto antibodies, islet cell antibodies and GAD antibodies, and see whether it is autoimmune mediated or is negative, then it's genetic. That's all. So
Sir,
nothing to worry, but all its age is like placed on adolescent and 20-25. There is no diabetes.
is there a chance that she will also get diabetes? Is what probably what she's worried about.
If she is around like 30, 40, so but depend on risk factors. Genetic is I'm telling is a younger onset, childhood, type 1. It doesn't have diabetes now, means type 2 she can develop at any time, irrespective of the parents' history of diabetes. Because the risk factors, she is obese, if she has having any other risk factors, she can develop diabetes.
So genetic factors, but has to have risk factors also. So both together
Not necessarily
is
genetic.
that
Genetic is the most commonly type 1, or
type
irrespective of the
one?
risk factors, it's type 1.
Type one.
Type 1, type 1, type 1.
Mm-hmm.
So it's very childhood onset for type 1. Type 1 either it's a genetic or autoimmune. Still we have to see. If they don't have diabetes in the childhood, then later adult onset or adolescent onset, most likely to be type 2.
So I think Asha should be more concerned about the risk factors and modify the
Correct.
risk factors right now rather than worrying about the genetic.
Yeah.
Right. So I hope that answers your question, Asha. Few more questions. Again, same thing. What is the secret of diabetes reversal? How can I prevent diabetes? Few questions are there.
There
Sir,
is
I think
no
we have been discussing the same. Yes, sir.
there is no secret as such. The thing is modify your risk factors. Diabetes reversal, don't aim for diabetes reversal. Please make sure you modify all the risk factors. You have to just make a checklist and see what all you have risk factors. Your weight, your sleeping habits, your exercise habits, your relaxation techniques, and whatever your diet, what all you have, what time you are having, everything. Small things. So try to modify them. Let's see. There's nothing like the secret.
Sure, sir. So diabetes reversal, from what we discussed, is a myth actually because it is not sustainable. If at all we get a transient reversal, probably in some patients who have modified risk factors, and there is no one size fitting all. ಎಲ್ಲಾರ್ದಕ್ಕೂ ಬೇರೆ ಬೇರೆ risk factors
Correct.
ಇರ್ತವೆ. ಎಲ್ಲಾರ್ದಕ್ಕೂ ಒಂದೇ
Correct.
ತರ ನಾವು ಹೇಳಕ್ಕಾಗಲ್ಲ.
Correct.
ಕೆಲವರಿಗೆ if there are morbid obesities ಸ್ವಲ್ಪ weight loss surgeries ಇಂದ ಅಥವಾ ಕೆಲವು ಮೆಡಿಸಿನ್ ಇಂದ ಕೆಲವು weight loss ಆದ್ರೆ that can also help in diabetes control very well.
Correct.
But all in all, it is more of a combination of things, modifying the risk factors with medication and individualized treatment is
Yes.
what probably, if I'm correct, this is what we are
Correct.
aiming at.
Yes. Correct. Correct. Correct.
Sure, sir. There's one more question from Sushma. She asks, is diabetes and hypertension linked? Not completely with R, but overall, can we also?
Okay.
Yes, sir.
Because once we get diabetes, we invite all other brothers and sisters. The others are like hypertension and dyslipidemia. These are the other which the systemic involvement comes in. The linked in the sense it's a common risk factor. Hypertension also has the same risk factors: smoking, alcohol, stress, lack of physical activity, or the obesity, everything. It's a common risk factor for both. So because of the changes in the endothelium functioning, the diabetes, it invites hypertension. Both almost
So,
like they can happen at any time. What I've seen, I was working in Jayadav Institute of Cardiology for 2-3 years. We have seen people having heart attack at the age of 20, 25. No risk factor except smoking. They stop smoking. Then down the line, after 10, 15 years, they develop diabetes and hypertension. So we don't know whether they were destined to develop these things. Don't know. And most of the patients, we see them, they have a smaller caliber blood vessels. The diameter of the blood vessels is very small. People who are tend to develop diabetes and hypertension.
Sure, sir.
So these are things. Don't know.
Sir, we are almost nearing our closing time. I would just I'll request you to please share your thoughts, maybe summarize what we just discussed, and some things for the public to take away.
Well, don't aim for diabetes reversal. Aim for diabetes control. Third point is modify the risk factors. All the risk factors. One might be having one or two, some might be having more. Modify all the risk factors in consultation with your physician and dietitian. The fourth point is don't change your medications on your own. Then always keep your physician in the loop. And you ask your questions openly to your physician, he will address the issues. So no physician will deny, will not address them. Please speak to them. And aim for diabetes remission, not for reversal. Modify the risk factor.
Sure. Thank you so much, sir. Diabetes ರಿವರ್ಸಲ್ ನ ನಾವು ಟಾರ್ಗೆಟ್ ಮಾಡಬಾರ್ದು, ಡಯಾಬಿಟೀಸ್ ರೆಮಿಷನ್ ನ ಟಾರ್ಗೆಟ್ ಮಾಡಬೇಕು, ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ನ ಮಾಡಿಫೈ ಮಾಡಬೇಕು. That is a most important takeaway for all our audience today. Please look into all the risk factors and try to modify them. That will be the biggest thing which we can learn today. Thank you so much again, Dr. Bindraj sir, for taking time out and discussing diabetes reversal. Please meet your diabetologist and so that we can discuss about all these things which we talked about today. Thank you so much once again. Ellargu namaskara. Good night. Bye.